Hello and welcome to the Machinist News Network. I'm Deirdre Kanievsky. With the presidential election just weeks away, Americans are taking a serious look at the issues. And as always, healthcare is close to the top of that priority list. Whether you are a local citizen trying to change the system at the grassroots level or using your seat on Capitol Hill, it seems like everyone in the country is talking about healthcare.
A lot of Americans aren't too wild about our healthcare system, but they understand it. It's kind of the devil you know versus the devil you don't know. And so I think a lot of Americans just want improvements, but they're a bit concerned about changes that might disrupt what they currently have.
And then there's the problem of the 47 million Americans who are uninsured in this country, an issue the president of the American Medical Association calls a tragedy and a national disgrace.
And that's about 1 in 7 of us. And these are not people who live under bridges. These are people who are members of our families, who are neighbors, who are acquaintances.
When it comes to health care, the working class is the group that gets hurt the most. And that's why the machinists have always led the fight for health care reform.
And I think machinists have always been in the forefront of being active and motivating others to come along and fight for an issue. Well, this is a good time for them to do it with health care. And I really think that we have an opportunity and we have the ability to do that.
If you've ever been part of a negotiation, you know how much time is spent addressing health care costs. Creating a national plan and taking health care off the table leaves time and money to address other issues.
We may be able to focus on pensions instead and increase pension benefits more. If employers didn't have to, if their profits weren't being eroded as much by healthcare costs, there may be money that can be, placed elsewhere for our members that we can negotiate.
If the machinists can set the curve on what a health care plan should look like, then everyone wins, inside and outside of the union. Because today, rising health care costs are no longer just a blue-collar issue. Companies are looking for a partner to conquer this beast.
Because it's such a difficult issue that they're really looking for any solution to the problem, and they'll listen to a union that has been involved in the issue for several years and has a good track record and good experience of dealing with healthcare issues.
The reality is this is one that binds us all together, regardless of party, regardless of whether or not we're advocates for labor, regardless of whether or not we're advocates for the private sector. It's a moral issue, yes, of course. It's an ethical issue, absolutely. But it's also an economic issue.
Negotiations always has a time limit. And sometimes it's not enough time to really tackle all the issues that are involved with healthcare. So we'll set up a committee to continue on the discussion. It'll be joint labor management, maybe 3 folks on our end, 3 from management, and they'll continue the discussion on into the future.
From K Street to Main Street, there seems to be a renewed sense in seriously looking at the healthcare issue. And the machinists want to make sure they are leading the pack.
We're always lobbying, doing our own lobbying on Capitol Hill regarding healthcare change, and there seems to be a more receptive ear to it. And so, getting out there in the public airways too, getting the word out, and increasing our dialogue with employers and building coalitions, I think, is important too.
I think there's a very good chance that there's going to be a renewal next year or two, kind of a renaissance of some kind in America. We are the country with more creativity, more energy, ingenuity, and entrepreneurship than any other country in the world. We still are.
The IAM is looking for concrete ways to cut healthcare costs. Things like pooling workers from various locations under the same plan to cut risks and monies, or making sure that Americans know that preventive care, like regular doctor visits, can save lives. For more machinist news, you can log on to goiam.org. Thanks for joining us.